your life. Joining us this afternoon with details on first aid kits is Dr. Ken Shufeldt with Native Air.
How you doing?
Thank you, Dr. Shufeldt, for being here today.
Thanks.
Well, first off, how big of a first aid kit should we have at home?
Well, you can actually buy some over-the-counter first aid kits that are relatively small, and that's the downside to them. They're not super expensive, which is great, but again, you use a couple Band-Aids and bandages and your first aid kit's basically ruined. Embarrassingly enough, when I talked about doing this segment today with you, I did not have a first aid kit at home, and since I do this for a living, it is a little embarrassing, so I went out and purchased everything for it.
What are the basics that every first aid kit should contain?
Well, kind of off the top of people's head, it's the things that come first to mind. Basically, Band-Aids, bandages, different sort of Telfa pads, for example, Curlex wraps, things that you need every day for your everyday cuts and bruises. And anybody who has kids understands that kids come in all the time with skinned knees and need a little dressing placed upon them. You get a little more exotic and get ace wraps for like sprained ankles, for example. I think more importantly, though, different medications that you can have in it. Again, Carrie, everybody knows basically the ibuprofen and the Tylenol. But what people may not remember is that things like cortisone cream for bites and stings is excellent to have on hand.
Are there any things that we should not put into a kit, Dr. Shufeldt?
You know, I think at this day and age, probably Ipecac is one of the things to try to keep out of your kit. Ipecac's kind of gone out of favor, for example. It's what you give people who've overdosed on something, and what it does is causes people to vomit. And poison control centers are really steering away from the use of Ipecac right now for a lot of different reasons.
Where should we keep this kit in our home? Where's the best place?
Probably the best, you know, it's where I found a few of the things was, you know, under the sink. And so it's in the bathroom under the sink. And it's, if you can keep it all together and keep it in a kit, at least it keeps it contained. So when you're traveling, for example, when somebody is injured, you can just grab the kit and take the kit to them instead of bringing the patient or typically your relative or your child to the kit.
Now, if you're going to go camping, let's say, do you need to have a different kit when you do that, something that's maybe more full of things that you might need in an emergency out in a situation like that where you're far away maybe from a hospital,
right,
than one that you have at home? Yeah,
that's a great question. And some people have actually carried small splints with them, and again, this kind of ace wrap that they carry with them. But a splint that you can splint an extremity with, I think Benadryl is a great thing to carry in a first aid kit. Triple antibiotic cream, so if you do get a cut or an abrasion when you're out in the middle of the wilderness, you can smear it on there and really take care of some of the potential for infection.
Great things to have just in case of an emergency. We do want to let people know that there will be a list of these items on our website, Phoenix360.